Hey, welcome back to Humans of Healthcare. My name is Danny Mobley. We're joined again by Ann Richardson. She's going to be a staple with Humans of Healthcare moving forward. So get used to seeing her. Welcome back, Ann.
Thank you.
Thank you for being here. We've been talking so much. Whenever she comes to town, we get this beautiful studio, these great people behind the scenes. We get an opportunity to have dinner, and we talk about things that we're going to talk about today. We talk about life in general. We talk about what's going on with each other, and it's always such a pleasant experience. So we're going to do this a lot more because we like it. So today, on this episode, we're going to talk about a famous, newly famous show called The Pitt. And I was turned on to this show by my daughter, Sam. She told me, I don't know, it's just been about a month ago, that this was the most accurate show she's seen that matched her experience as a nurse working in a hospital. And so I was intrigued. And what I did immediately was jump in and just watch the entire series. So I binged. My wife and I were sitting on the couch watching this. And so I wasn't necessarily watching it with a critical eye. I was just more trying to be entertained. So I went into it with just, hey, let's see what she meant by that. And because I don't have a point of reference, I've never worked in an ER. I was a police officer. But then that gave me the ability to understand what it's like to be a health worker in regards to I'm not doing it to be a hero. I'm just doing it because this is my job and this is what I love to do. And I do want to help people. But I don't want to be considered a hero. But, so I get it from that vantage point, so to speak. But I don't know what goes on in an operating room or emergency room or, on the med surge floor. I've never worked in it. So I can't really have the appreciation that Sam has, but you can. And so I thought this was really kind of cool. Maybe we use this show and we pick out snippets and we just talk about what we're seeing. And we looked at a clip together today, and the reaction that you had was palpable, right? I mean, it kind of hit you. And I could see as you were watching this clip how you changed. I mean, your body language changed.
So we watched barely a 5-minute clip.
Right.
And as I said to you, that 5-minute clip was powerful. There was a lot of content in there to talk about. So first, the scene of the attending hiding from the administrator.
What do you mean, Robby?
Escaping? Dr. Rabinovich.
Gloria.
This is
Clearly, there's a history of the administrator only showing up when they have a mandate to talk at us and not share with us on how we can work together to make things better. So that's very common.
Yep.
Conversely, leaders also know when there's resistance from physicians and nurses and other clinicians. So I've worked in organizations where they would avoid going to a clinical setting because they knew they weren't welcome. So guess what? Conversations don't take place, relationships don't get built. Change, if it gets to the point where it needs to be mandated because now you've reached some crisis point, let's say financially or with access, now it's really unpalatable because now the people that are doing it from some email mandate from afar, and you've lost track of what they look like, their faces and names have changed. So that scene I'm very familiar with. But the other scene that was very powerful, and it was intentional, was the wall with the heroes.
bottom line is our current numbers aren't good and theirs are.
Just because their dashboard is pretty doesn't mean.
Most clinicians don't even, it's almost like the F word in healthcare these days, heroes, because they view themselves as, we're professional people. We're nurses, we're doctors, we're social workers, psychologists, all the various clinical disciplines, and even the non-clinical disciplines that are there to support the delivery of patient care. They don't consider themselves heroes.
No.
We've been trained to do this for years. We show up and we do our work and we're professionals. And and then during COVID, that became really, popular, heroes. And then as soon as, COVID went away, those same heroes, were often kicked to the curb, so to speak, and they didn't have the support and love and respect of the systems to give them what they needed, especially at a time when a lot of them were really hurting because they suffered a lot of loss of human life, which not only was their patients, but some of their colleagues. So that wall was I found that to be very, very powerful. And there was a reason for that because there's a lot of resistance against that term of that wall of heroes. Not to say they're not great people, they are,
Yeah.
and they're deserving of being portrayed. But if that wall showed 10 people, there was probably another 100 that for some reason aren't on that wall, and they're no less important to the flow of taking care of patients.
Well, and to your point, like that, so there's pictures of like people's faces on that wall that were hanging, and it was just like a memorial type thing, right? But the other thing that you just said that because, there's so much to this series, right? There's so many things. The part about COVID is real, and it shows flashbacks of Dr. Robby during COVID, in the other episodes. So
Yes.
that's the other cool part you just, naturally mentioned is, that COVID played in this series as well, as so it's like that's a really keen point, is that it is mirroring some of what's real life, which I think is what makes it so real.
And so that administrator came through and lacked self-awareness for her surroundings, meaning that clearly she knows she's in an emergency room, okay? So you're in an acute setting where people come when they're sick. Now, we all know that people go to the emergency room that don't belong there, but in the absence of primary care in their community and access to timely care, they often show up because it's the only care that's available. So it's not all level 1 trauma. But nonetheless, in the eyes of the patient, they're sick, they're not well, they're there to be cared for. And they deserve that respect and privacy to be able to have a team focusing on them and listen to their story to then to triage them and determine what's the best course of action. But here's this person who should know better, who's coming through as if none of that matters, and then starts spewing the words that are the F words, metrics, okay, and talking about patient satisfaction and so forth. And I'm a firm believer that there's a correlation between care team satisfaction and patient satisfaction. Patients are smart enough to see when their team is constrained. They're smart enough to know that this wait is really long.
Yeah.
And so even if you have the best physician in the world, the best nurse team, and all the clinical disciplines, interprofessional team to take care of me, you still know that the delays and maybe the omissions and God forbid the errors, okay, all can translate into bad outcomes and poor satisfaction by the patient. The care team feels that way too, because nobody shows up to go to work and upset their patient. So when that lady walked through in a leadership role and just kept following him around, it was offensive, but not shocking to me because it happens every day in a lot of organizations. And so then the consultant type that showed up, when he said to her, "Did you go to medical school or business school?"
Did you go to business school or medical school?
Both.
She said both. So she's MD, MBA, more than likely. So I'm an MBA, a lay MBA, but I happen to be one of those MBAs who really does care. And shame on that MD, MBA, and shame on that nurse executive. Shame on them. Because they are clinicians by training. And so, aside from the fact that we're all human beings, okay, so where's that all lost? So when she pushes back to him and is representing a management company, and that's usually code for we're a private equity firm.
Tracy Morris, Regional Manager of ECQ America.
The contract management group.
It's a pleasure to meet you.
More than likely, private equity has really infiltrated emergency medicine. And what I mean by that is that, years ago when I started my career, a lot of emergency medicine practices were private practice, very well respected. They had a lot of autonomy. They went in and did their 10, 12-hour shifts. Great doctors, hospitals had great relationships with them. Over years, things changed. Some hospitals employed them. Today, we have private equity who's purchased a lot of these groups. And so that's another whole segment or two about private equity and emergency medicine. But that's what that represented. They quickly threw to him as if it was a carrot, which I felt was very vulgar and obscene, which is another reason that clinicians hate private equity and MBAs and administrators, regardless if they're clinical or not, was, talked about pay and talked about title will make you. This guy, for all we knew, had how many bays in the emergency room filled with patients that have been waiting?
Robby.
Your hospital's board was very impressed with ECQ's metrics on patient satisfaction, throughput time, and billing collections.
Does your proposal include the part where you cut the pay for all my doctors?
Maybe I can find an incentive for you. How does regional medical director sound? Lighter workload, better benefits, stock options.
We said that we have patients waiting more than 6 hours.
6 hours, yeah.
And we need more staffing. How about we address the staffing for staff beds so that we don't have the bottlenecks on the inpatient side, which result in bedding in the ED and long waits.
Yeah.
And so he was as polite as he could be
Yeah.
because he's a professional and he's a gentleman. And he's also, you notice they're right in the thick of things. So he's within an earshot of his colleagues, listening to every word that's being said.
Absolutely.
Which is why that nurse who could hear came and actually threw him a lifeline.
I need you to care about patient satisfaction.
I would love nothing more, but right now the average wait time is 6 hours, and that's before you see a doctor. You need to hire more staff.
We got a ladder fall. A couple minutes out. Yep.
That was her way of, without doing an eye roll right in front of these two, saying, would you just please move along? Because we have patients to take care of.
Yeah, yeah.
You talk about patient satisfaction, but the longer this conversation
Yeah.
goes on,
Yeah.
the longer patients are going to have to wait. And there is a correlation between wait time and patient
Yeah, yeah.
satisfaction.
Yeah.
So that nurse was totally on point.
Yeah, yeah. She's
but
like the
that nurse
mama
sees
bear.
it all the time too.
Yeah.
They don't want to have a confrontation
No.
because they're also in a no-win situation. Even though you're the team taking care of the patients, and that should matter the most, depending on what we call the lack of psychological safety that you have in the organization you work, it could be used against you
Yep.
if you really speak up.
Sure.
And they also show the level of professionalism that they, put some guardrails up in terms of what they were willing to share or feedback, because that wasn't the time and place.
Right.
And then the nurse executive kind of pointed and she said something about the executive suite.
Yeah.
That's another thing that nobody else wants to hear. It's like, well, why don't those folks in the executive suite, get in their car and drive? Because a lot of times they're not even in the same building.
Right.
Use GPS to find us because maybe they don't know where we are.
Right.
And come here. First of all, I wouldn't have had a conversation like that in that open
setting,
area.
yeah.
But I was able to develop relationships with people that I could have that conversation to say, hey, do you have a few minutes? Because trust me, I did this. Let's go in what we call the clinical director's office. And we'd sit in there privately, and sometimes I'd have a little round table with 5 or 6 anesthesiologists to give them the lay of the land. Hey, this is what's going on. Thought you should know. What do you think? And then we'd go back and forth. But I was welcome in that area because
Right.
they knew I wasn't going to come in and mandate something. I wasn't going to dump something unfavorable to them and then walk off on my heels.
Yeah.
They knew I was going to be there to listen to their feedback and talk about what's going on, or what are your thoughts? How can we do this? So I know that the bandwidth of people in leadership today in hospitals is stretched thin, and we've talked about this before, the span of control. So if I were in a hospital today, I probably would be one of those people that would be given several more hats because I would have no choice, number one, but I would take it on because I'd want to make a difference. But I'd be very stressed and sad knowing that I can't possibly lead the way that I'm used to.
Sure.
Because I'm used to going to labor and delivery. I'm used to going to the NICU. I'm used to going to these areas and on the ambulatory side in the clinics, because if I was stumped by something, let's say in a revenue forecast
Mm-hmm.
or volume, because that's a big part of my job too. So I was that metric lady, but I wouldn't have to go and speak to them the way that she did, because I would be in a setting enough that I'd be able to figure out where we have opportunity.
When I was asked or told by my daughter that this was the most real thing, I didn't expect to see this stuff. I didn't expect to see and get the reaction that you gave. Is like, it's those things that are like visceral to you, right? Those are the things that jump out. And I wonder if the general public, I doubt it, they probably see that as a benign part of the whole series. They're waiting for the blood and the gore and all the stuff that goes with it. But that, to us, as we watch it, it's like, you have a reaction.
Well, so that clip shows the business side of it,
Yeah.
which, as much as people don't like to think of healthcare and medicine as a business, it is.
Yep.
And so that clip also mentioned, now that consultant because people use the term administrator and consultants loosely. So I'm a consultant, but I'm also, a consultant because
Yeah.
I was a former health system administrator in a leadership role.
Yep.
So people use that, and then they throw out, well, then the MBA. So I am just like,
Yeah.
I am completely the dark side to a lot of people.
Sure.
But the person who was a consultant in that scene, she was an MD.
Yeah.
Because he said, did you go to medical school or business school?
Yeah.
She said both. So she's an MD, MBA.
Yeah.
Okay. And a lot of them are.
Yeah.
But the thing that she brought up that, he was just trying to keep his composure and focus on his
Yeah.
patients. And I'm sure his blood was boiling.
Yeah.
Mine was listening to the whole,
Yeah.
because I witnessed this and it's just horrible.
Yeah.
Where she said, how they're complemented their strength and their revenue cycle and their billings were good. So she went right for the money.
Yep.
Of course, that's what
Yep.
private equity is looking for,
Yep.
and patient satisfaction and so forth. So,
Yep.
so while the show, The Pit, I think does a very accurate depiction of like the dark side of the business side and what the clinicians are going through. It doesn't obviously tell the whole story,
Right.
and you really have, having a trained eye helps. Like
Yeah.
my eye is trained,
Yeah.
and a lot of the clinical folks that watch it are trained as well. But it's not perfect, but it can be a catalyst for good conversation, increasing awareness.
Sure.
Because one of the complaints that I hear and I agree with is that there is not a lot of empathy and sympathy in the public for doctors. Most people still feel that they are privileged and they make too much money, which couldn't be further from the truth.
Right.
Couldn't be further from the truth. So
Right.
that's what a lot of Americans feel.
Yep.
And then if you ask them how they feel about nurses, even though every survey will come and tell you they're the most trusted, it's kind of a mixed bag in terms of how they might feel about nurses. And while it's mostly positive, they also realize that there needs to be a doctor in the mix, right? Who's directing things.
Yeah.
And so I do feel that it has value, the show,
Yeah.
for sure.
Sure.
And I think that as it continues to go along with feedback, and I don't know how, the show is getting feedback, but I would think it would become more realistic to show the constraints on clinical teams with, we know that in health systems today, now we have federal cutbacks
Yeah.
that are impacting
Oh, yeah.
Medicaid and
Yep.
so forth.
Yep.
There's talk about how it could be impacted with CMS for Medicare.
Yeah.
Third-party payers are cutting reimbursement. Reimbursement in some areas might be going up, but shocking, CMS is looking at cutting physician reimbursement again.
Yeah.
Okay, and so those are all the reasons that physicians are working and hospital systems are working under constraints. And so good people are leaving.
Yeah. Yeah.
And
Yeah.
so when more and more good people leave, whether they're administrators, they're, direct patient care providers or nurses and so forth, it puts more constraint on a system
Yeah.
because your staffing becomes more expensive because you're contracting for labor
Yep.
on a limited basis
Yeah.
as opposed to employing them as a W-2 employee. So the financial constraints are there. So I think the show as value, but also the thing that worries me, though, is the vitriol and demonizing of all administrators.
Sure.
So when we have, I've mentioned this before, the CEO of United Healthcare gets murdered, cold-blooded murder, premeditated on the sidewalk.
Yeah.
A lot of people celebrated that. They're still celebrating
Oh, yeah.
it.
Yeah, they are.
Yeah. And so it's not a good thing.
No.
And just like we don't want to make a blanket statement to say all nurse leaders are nasty, because they're absolutely not.
No.
There's
not
some
close.
phenomenal nurse leaders
Yeah.
out there. Most of them are wonderful.
Yeah. We just talked to one.
Wonderful. Same
Yeah.
thing with physician leaders, MBA leaders. But if we make these broad brush statements to say that they're bad,
Yeah.
and you look at that show and you
Yeah.
look at that clip,
Yeah.
that's definitely highlighting. It's probably not even the worst of what we could see in
Oh,
health,
for
because
sure.
I know it was far worse. Trust me, I have stories on that. But it's still not good,
Yeah.
because. But on the other hand, if we were to take an outlier of how it can be and how it should be, that would frustrate people too. You know why? They'd sit back with sadness and go, why can't I have that?
Yeah.
Why can't I have that? So
Yeah.
some of the feedback that you see on emergency medicine physicians on the show, which I think is great, is my family loves the show and gets to see what I do every day because it's a more accurate depiction of what goes on.
Yeah.
Some of the feedback, people feel like some of the mental health issues might be overly stigmatized in terms of how they portray some of those patients. But I think with some of the feedback that, they would address that as well.
Sure. I think it's interesting, at least to the public, to get your vantage point and how you watch the show from they're sitting back being entertained, but what clinicians or actually anybody in healthcare might see might be different, and so if I'm in the general public and I'm watching these episodes of us talking about different clips on the show, I'd be kind of curious to see, hey, is that real? Is that really how it works? Is this just all fake? It's just something in my mind as a human being that when I watch something, I always kind of wonder, because I'm a former police officer and I would watch Cops, and that's a documentary for the most part.
Yep.
But then I would watch Law and Order and I would watch all these other things and I'd be like, nah, that's not real. And I would just dismiss it, which is okay because I could settle into it just being entertaining. But there was something that I would appreciate when I would watch shows that I was like, yeah, that's kind of more to real life. And that's what Sam, my daughter, was telling me about this one, is like, hey, you can watch this one knowing that, to me, this is more of what my experience has been. So we'll end it with this, and we'll get on, have other episodes here in the very near future for you, everybody. So thanks for watching, and let us know what you think.